Hello, and thank you for your willingness to learn a little bit more about the essential caregiver role at Sandstone Healthcare Center. In an effort to provide continued support to our residents' physical and emotional well-being, we are electing to participate in this optional program by the Minnesota Department of Health. Your role as an essential caregiver and compliance to infection control practices are crucial in the continued physical health of our residents and staff. We have been COVID-free and intend to remain that way. So please be mindful of not only your time within the facility, but your infection control practices outside of the building and the community. If you decrease your risk and exposure, you will then decrease ours. Upon entry to the community, you will be screened for any COVID-related signs and symptoms, along with obtainment of a temperature. If there is another staff member or essential caregiver waiting to be screened, please be patient with us as we work through the line. And be aware of the 6-foot social distancing guidelines. There are marked locations on the ground to be able to assist with this. During the screening process, it is crucial that you are candid with us about any ailments that you may be encountering. If you are ill in any way, please do not visit. Our first and foremost priority is to ensure the safety and health of the residents at Sandstone Healthcare Center. You will receive an authorization form and education related to the necessary practices and policies for your essential caregiver visits. It is mandatory to comply with these practices to maintain infection control practices and ensure that we are able to continue to complete essential caregiver visits. Violations will be handled on a case-by-case basis, but please be aware that violations would result in suspending visits. Personal protective equipment will be provided, and this will include a surgical face mask and eyewear. You will have an option between goggles and a face shield. Please note that these forms of PPE are required at all times when in resident care areas, including hallways and the resident room. These forms of PPE are required throughout the entire duration of your visit. As PPE supplies are limited due to the pandemic, if you have safety goggles that you wish to bring, you may utilize them if they cover the front and side, as long as you sanitize them prior to use. You will be provided a bag with your PPE in it. Please reuse your surgical mask until it is visibly soiled or requires replacement. A surgical mask has 2 elastic straps on the side and a nose piece on the top. The colored side goes out. The elastic straps go around your ears, and the nose piece is to be secured around your nose. It is important that your surgical mask covers both your nose and your chin. When you are removing your face mask, utilize the elastic straps at the side to take it off. Prior to placing your surgical mask in your bag at the end of your visit, you will fold your surgical mask in half with the outside or the dirty side facing in. This allows the exposure inside of your bag to only be the clean side. After removal of your mask, please sanitize your hands. The other form of PPE that you will be required to utilize is a face shield or goggles. Again, before and after each use, you should utilize alcohol wipes to clean the inside and the outside of your goggles. And again, this is at the beginning and the end of your visit. And you would clean them prior to placing them in your bag at the end of your visit. If you opt to utilize a face shield, they look like this. Again, you would clean it at the beginning and the end of your visit, and they go on like this. Similar to the face mask, it is important that your face shield cover your chin and the side of your face. And again, you would clean this. The intention, everything that goes in your bag should be clean to ensure a lack of contamination and ability for reuse during your next visit. You will see that alcohol-based hand rub is readily available throughout the community. Please routinely utilize this, especially upon arrival to the facility, prior to entering a room, and upon exiting a room, prior to leaving the facility, at any point in time that you would touch your PPE or come in contact with contaminated surfaces. For containment purposes, the visits will be limited to the resident room or designated area if necessary. Your visits will be in 1-hour blocks. At the end of your block, you will be asked to sign out on a log that indicates that you have complied with all of the PPE guidelines and usage during your visit without breach. It is extremely important that you continue to follow these guidelines to again ensure that our facility remains COVID-free. We appreciate your participation and willingness to participate in the Essential Caregiver Program. Please note that if you have any questions, whether now or down the road, that come up related to these visits, you may contact any member of our leadership team. Thank you so much for your time, and we look forward to seeing you.